Hi, welcome. I'm Vaidehi Mujumdar. I'm a second-year OBGYN resident. Today I'm going to be presenting on surgical management of abnormal uterine bleeding with endometrial sampling during COVID-19. As health surveillance has changed due to COVID-19, it is imperative to identify modifiable barriers for greater efficiency in cancer care delivery. The objective of our study was to investigate surgical management of AUB with endometrial sampling during the peak of the COVID-19 pandemic at a single urban tertiary medical center. This was a retrospective chart review of 868 patients. We did collect baseline patient characteristics, including age, self-identified race or ethnicity, and BMI. Time from an abnormal endometrial biopsy to surgical management, use of at least one telemedicine appointment between biopsy and surgical management, and resulting pathology results were collected. Our results showed that in 2019, 466 patients underwent an EMB, while from January 1st to March 23rd, 2020, 402 patients underwent an EMB. In 2019, 4.9% were diagnosed with an endometrial malignancy and 95% had resulting benign pathology. In 2020, conversely, 5.2% had a diagnosed endometrial malignancy and 94.8% had benign pathology. Table 1 shows us the differences between endometrial sampling and management in 2019 versus 2020. Overall, you can see that the median times between biopsy and surgical management, measured in days, or the median time between biopsy to surgery for patients with an endometrial malignancy, and the median time between biopsy to surgery with benign pathology, overall increased from 2019 to 2020. During the COVID-19 pandemic peak, individual patients with abnormal uterine bleeding may have experienced delays between initial abnormal EMB and surgical management. However, there was no statistically significant difference in time between biopsy and surgical management for AUB when comparing the populations. This really reinforces the quality of care given to our patients.